Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, digital flashcards, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I teach on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 70-year-old male presents with a 4-day history of fever, chills, productive cough with green sputum, and shortness of breath. On physical exam, you hear decreased breath sounds and crackles over the right lower lung field. A chest x-ray shows a right lower lobe consolidation. What is the most likely diagnosis? Is it A, acute bronchitis, B, community acquired pneumonia, C, tuberculosis, or D, pulmonary embolism? Take a moment and tell me what you have in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the most likely diagnosis? And I always tell y'all, if they're asking for a diagnosis, you need to run it back and look at those assessment findings, right? So how did they present? What are their chief complaints? What are their signs and symptoms? What was noted on exam, right? When you did your assessment. So we have a 70-year-old male, sorry. He has a 4-day history of fever, chills, a productive cough, shortness of breath. On exam, decreased breath sounds, crackles, chest x-ray shows consolidation. This is classic presentation of pneumonia. So B is your best answer, community acquired pneumonia. Question number 2. A 50-year-old female with no significant past medical history presents with mild fever, cough, and fatigue. A chest x-ray confirms the presence of a right-sided lower lobe infiltrate. She is otherwise healthy and has no symptoms of severe pneumonia. According to current guidelines, what is the most appropriate first-line treatment for her condition? Select the best two. Is it A, oral azithromycin, B, oral doxy, C, oral amoxicillin, or D, oral ceftriaxone? Take a moment and tell what you got. All right, so stem of the question here states, according to current guidelines, what is the most appropriate first-line treatment for her condition? Select the best two. All right, so what's the condition? So we have this 50-year-old female, no significant past medical history. She has a mild fever, cough, and fatigue. Chest x-ray does confirm right-sided lower lobe infiltrates. So we know that this is a positive finding for pneumonia, right? So it says otherwise healthy and has no signs of severe pneumonia. So we know we are treating a mild case of pneumonia. So first line therapy where we can do monotherapy, right? In those mild cases. So select the best two that you would utilize as first line therapy for someone with pneumonia. And your best answers are A and C. Remember your macrolides and your high dose amoxicillin, right? So macrolides and then mycin. So your azithromycin and your amoxicillin are options that you can use in this particular scenario as your first line therapy. Remembering when they present like this, they're mild, straightforward pneumonia, then you just need monotherapy on that case, okay? Now, if it was something that they had additional symptoms, they're more severity, or they have been treated in the past for it, or whatever, you may warrant dual therapy, and then you can do both of those. Or other alternatives, or if you are in the third line therapy option where you needed those big guns, then that's when we start to do like our respiratory fluoroquinolones and things. And I'll give you more questions like that. And if not, you can go look at those other pneumonia videos to help you with that. But I just wanted to give a scenario so you can kind of see and consider when you can use monotherapy, etc. All right, and lastly, question number 3. A 65-year-old male presents with a 5-day history of fever, productive cough with green sputum, and shortness of breath. On examination, you hear crackles in the right lower lobe. The patient has no significant past medical history. What is the gold standard diagnostic test to confirm the diagnosis of community-acquired pneumonia in this patient? Is it A, a chest x-ray, B, a sputum culture, C, blood cultures, or D, a CT scan of the chest? Take a moment and tell me what you got. All right, so STEM the question here states, what is the gold standard diagnostic test to confirm the diagnosis of community-acquired pneumonia in this patient? Do you see why the STEM of the question is so powerful, right? Because this alone tells you everything you need to know. And again, y'all know my spiel. Oftentimes, you will run into these huge scenarios on boards that are real fluffy, gives you a lot of detail, but it's not even the detail that you really have to answer the question. Because here's straightforward, y'all. Simply, what is the gold standard that we utilize for diagnostics for pneumonia? It's a chest X-ray, right? So A is your best answer. Simple as that. But to make sure that you're answering appropriately and to ensure you're answering what they're even asking you, always read that stem of the question first. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. All of the things that I do offer are linked in the bio of this channel, as well as my website, so that you're able to see those. I have removed the link for my one-on-one sessions because I always say either call, text, or email if you're looking to book any one-on-one or custom plans, because I like to speak with you to gauge what you truly need to make sure you're booking the appropriate session type. But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.